Now, while this breakthrough may change the way surgeries are done, a new NASA imaging system may change the way they are planned. The same spectral scanning methods developed for satellite photography and the Voyager trip to Saturn are now helping in diagnosis.
The actual surgical procedure that's done on a patient, or whether the decision whether or not to do surgery, will be based on the results of this type of multispectral analysis.
By pinpointing a patient's problems electronically, these NASA graphic systems allow doctors to go inside the body without ever lifting a scalpel.
Was given a go for entering the...
NASA is now planning a manned trip to Mars by the end of the century, a journey that will take a year in each direction. What happens if an astronaut gets sick and needs an operation? The answer seems to be coming straight from the world of science fiction. Called the Virtual Environment Display System, it's the ultimate in 3D glasses. Listen to this. Wearing them, the surgeon could be millions of miles away on Earth and see his patient as though they were only a foot apart. With these special gloves, he may actually feel the scalpel in his hand and manipulate it by remote control.
The concept is telepresence, so basically the operator has enough, high enough quality sensory feedback that he feels as if he's in some remote location.
Here's how this telesurgery would work. A robot on the spaceship with a TV camera eye feeds the picture back to the surgeon's 3D glasses. As the surgeon moves his hands, sensors in the gloves control the robot, which performs the operation.
Similar to what happens here, where you have a senior surgeon, junior surgeon doing an operation together, and the senior surgeon is guiding the junior surgeon, except the difference is they'll be separated by thousands of miles.
The connection is made by telemetry, the same technology that has made it possible for Brian Magnane to walk.
You can't really understand the feeling that the two of us got the first night after 9 years when your baby of 9 years old, walks to you, on its own.
Brian was born with cerebral palsy and needed a walker to get around until his surgery. Using this gait analysis system, which picks up signals from special sensors on Brian's muscles, orthopedists were able to determine which muscles were malfunctioning and operate to correct them.
He's doing really good. He practices dancing and playing basketball and does everything. He's a real character.
Our camera was there to capture the first time that Brian ever stood up on his own. It gives me chills up my spine to see that. It's so nice to see human results from space research. That telemetry thing is fantastic. Someday surgeons will be doing surgery on you over the telephone. The fees will be the same, of course, because we have pool payments also, Also, in space, we're learning a lot about medical conditions. There are certain things that happen to astronauts in space. They all get motion sickness sooner or later. Can you imagine throwing up in space? I don't know if they're going further with that, but this is a big problem in the space program. Also, thinning of the bones is probably the other major difficulty. And we're learning that in space, there's no pressure on your bones. You're floating all around, and therefore your bones get thin and continue to thin. So we're learning about osteoporosis and also fluid. You notice how astronauts always look puffy and weird in space? That's because they get a lot of swelling around their face and all through their body. So we have lots to learn from space. Its applications, I think, apply to all of us. Okay, don't anybody get better, because we're going to be back with more of Medical Journal. Here's a household tip. Combining some cleaning solutions, for instance ammonia and bleach, can be very hazardous to your health. And in many cases, you can't always depend on the labels to warn you. So be careful. A lot of people have varicose veins. We've been asking members of our studio audience, and lots of people have them. Not many people want to show their legs on television, but right here you've had them, and you've had them treated. No fun, huh?
No, it wasn't any fun. It was a long, long time ago, but my leg has been black ever since, dark, the veins. I thought that would cure that, and it didn't.
Yes, maybe that's the old way. We're going to show you some new things. You've had them also, sir.
I also had them a couple of years ago. I had them stripped. The pain has gone away, but I still have the lumps.
Well, we'll show you something new that maybe can take the place of stripping. Varicose veins are unsightly. They affect men and women. They are embarrassing. They can be painful. But don't despair, because there's some welcome news for people who suffer from varicose and spider veins. Legs. With all the abuse they take, it's no wonder now and then they ache. After all, we walk on them, we run on them, and we stand and we stand, and we stand, and we stand.
I started having a lot of pain in my legs. Real discomfort where I found myself picking my one leg up and kind of to give me a relief on the pressure.
Betty Jenkins had the classic problem. After standing all day, every day for 16 years grocery store checking, she had painful, disfiguring varicose veins.
They were thick, like a big rope. I always held my purse where my veins showed the worst.
Are you all right? Are you hurting?
Oh, no.
Surgical stripping was her only alternative, until she heard about a new technique called sclerotherapy. It's a procedure in which a caustic agent is injected into the vein, and almost immediately the discolored veins will disappear. The results are dramatic, and it works equally well for the small spider veins that often appear on the sides of your legs. Watch the fluid as it pushes through the vessel. In fact, like some sort of magic show, all kinds of veins can be treated. Now you see it, and now you don't. And again, before and after. Here are more varicose veins, before and also after. With even tough-to-treat veins on a foot, it'll work. As successful as all this looks, you'd think it would be a common procedure.
There aren't too many people interested in doing this procedure in America. Mainly, it's not trained in any institute. No one's trained in any institution for it. But gradually, people skilled in the European techniques are beginning to appear on the American medical scene.
Sclerotherapy isn't really a new procedure, but some years ago it got a bad reputation through misuse. Today, although commonly used in Europe, only a few physicians do it here. Dr. Duffy emphasizes that proper technique is vital, because if the liquid misses the vein, ulcers can result. Even more important is careful compression of the treated veins by taping, and then the wearing of thick support hose. This is crucial to success.
Generally, the bigger it is, of course, the more work it is. But vessels about the size of a pencil will often be gone in one injection after about a month of compression.
And so is the pain.
I didn't hurt anymore. Next morning when I took my shower, my veins were stripped, gone.
Okay, let me show you the normal way that most varicose veins are treated today. And basically, I heard someone say very close veins. No, it's varicose veins, not very close veins. Here's a straw, you see. Normally you thread a steel cannula down the vein, and then you do what's called a stripping operation. And this straw is being very stubborn, but you can see what happens when you pull that out. See, you get left with the vein all gathered up on the steel cannula, and it pulls the entire vein out. So it does work, of course. Now, this new procedure, sclerotherapy, may not be for every type of varicose vein or very close veins that there are, and sometimes, to be honest, it has to be redone. It's also very hard to find a physician who is into this and knows about it. So be persistent, because it might be worthwhile in the long run. We'll be right back with more of medicine. Trying to cut down on cholesterol? If so, which meat or seafood contains the highest amount of the artery clogger? Lobster, lean sirloin, dark turkey meat, or oysters? We'll give you the answer when we return to Medical Journal. Questions. And first, we have a letter from home. Our letter today is from a woman who says that she has lots of problems with cysts in her breasts. And 12 years ago, a doctor wanted to do a mastectomy for this. Mind you, this is not cancer. But after a second opinion, she decided not to have her breast removed. She writes, "It is a very painful condition. My lumps were as big as baseballs, but I've been taking vitamin E, 1,000 milligrams, 3 times a week for 11 years, and it keeps the condition under control, and I simply had to share this with you." Well, vitamin E is supposed to work. I have to say that. 400 units a day is supposed to be enough. But there are other things that may also do it. I'm a great believer in low-fat diets for this condition. You know, Japanese women, for instance, have very high rates of breast cancer. And when they move to this country, very low rates, lowest in the world. But when they move to this country, they get very high rates. Now, cysts it's not the same thing as cancer, of course, but we think that fat has something to do with it for fibrocystic disease of the breast, and also iodine. The latest thing is iodine. May be very helpful. Okay, now it's time for your questions. Anyone in the audience have any questions for us? Yes, let's go right up here first. Okay, stand up.
Okay, do you recommend for or against light weight training, anaerobic exercise for a 13-year-old with congenital heart disease?
Do you know what kind of heart disease is it? Do you know
Tricuspid atresia.
Tricuspid atresia. And has it been fixed, or anyone done anything about it?
Yes, 4 times.
They fixed it 4 times. This is a toughie. I would never tell you to tell your child to exercise without knowing all the details. In general, if it's fixed, we find that these kids can do pretty well. But we're also frightened with heavy weight training. You know, kids will overdo so many things, you see, and they go too far, they may be able to affect negatively bone and ligament and muscle attachment. So I would go real easy and do this in conjunction with your heart doctor, because they're the ones who know how well the heart's functioning. But if it's been fixed, it should do just as well as any one of our hearts. This is a blockage of one of the valves. So this is squeezing of, little squeezing of the opening so not enough blood gets through. Anyone else have any questions? Yes, just stand up.
Since antibiotics increase the risk of pregnancy in women who use birth control, how do diet pills affect the effectiveness of birth control?
I'm glad you brought that up. I don't know about diet pills, but the recommendation, first what she said, antibiotics, not a lot of people know this, antibiotics speed up your liver's metabolism of birth control pills. So you're taking antibiotics for who knows what reason, you're taking birth control pills, you wind up pregnant, because once again, the antibiotics help your liver metabolize it, so you have no birth control pills in your system. Now we're finding other drugs, a lot of pain pills, sedatives, hypnotics. So all of a sudden we're coming to the conclusion that maybe any woman taking birth control pills should not take any other medication, and if she does, she should use another method of birth control. That's the best protection, because you don't want to find out this one the hard way. So if you're taking diet pills, and you shouldn't be taking those anyway, if you are, we'll talk about that another time. Be careful. Okay, anyone else have any questions? Yes.
Does drinking cranberry juice help you with bladder infections?
Very good. You know, you hear about a lot of things that will acidify your urine, and when you have an acid urine, that helps with bladder infections. Well, it turns out most things you've heard about will not do that, but cranberry juice still remains as a potential for increasing the acidity, which should decrease your chances of getting bladder infections. This is prevention, though, not treatment. If you have a bladder infection, antibiotics are the best, okay? Let's have more hands here. Anyone else have questions? Yes.
Hi. About psoriasis, I want to know if there are any new treatments, or does anything really work?
Did you have psoriasis?
Mm-hmm. Yeah.
Can you show us anything? I hope it's a place you can show us.
I have
Okay.
some, but I won't show you.
Later. I'm a doctor. It's okay. All right. Can we see this here? All right. There's a patch of psoriasis. This kind of psoriasis in a localized area like this, there's a couple of nifty new things. This is changing. Always go back to your dermatologist for the newest, because there's so many things my mind is reeling at this point. One of the niftiest, this is strange. They found a group of patients with psoriasis. They put a Band-Aid on them, and the doctor forgot to tell the patient to take the Band-Aid off. So the patient left the Band-Aid on. They took it off 3 weeks later, and where the Band-Aid was, the psoriasis was completely gone. Okay? So now they're using occlusive therapy with a piece of plastic. You seal it up real good. You don't peek. And you just leave it there for a few weeks, and it clears it up. Talk to your dermatologist about that. That's a real nifty new treatment. Anybody else have any questions? Let's see. Let's run over here real fast. Hi.
Hi. The new surgical procedure to correct nearsightedness, I think it's radiokeratotomy. How safe is it?
Yes. You need this?
Yes.
Are you nearsighted?
Very.
What are you doing right now to see? You got contacts
Yeah,
in there?
extended wear.
Now, let me show you this with a drawing, because this has been controversial and is continuing to be controversial. But I must say the controversy is, is dying down a little bit. Now, basically, radiokeratotomy is fairly simple. We just take your basic eye here, okay? There's an eye, there's a pupil. We don't need eyelashes, right? We know. Basically, the doctor makes these little spoke-like incisions, not quite to the center, not quite through the cornea, and the shape of the cornea flattens. Instead of the curve being real steep, it flattens out. This was invented by the Russians, as opposed to some things the Russians claim they invented, they didn't. But the controversy is what happens years later. I would want to know. Let someone else try it first and wait 10 years before I'm going to have it done, because downstream you can get secondary complications. The other way to gauge this, I think as time goes on, we're finding it is safe. Not everybody, it doesn't work for everybody, you see, so you're taking a little bit of a chance here. But downstream, I think we'll find this will probably be okay. But when you see all the eye surgeons themselves having it done on themselves and their wives, then you know maybe we've got something. Okay, any more questions? Let's run over here. Yes.
How safe is it for a woman to have a child after 40?
Are you considering this? You're not there yet, are you?
No, but at the rate I'm going, it could be a while.
Well, there are certain increased risks to women after 40. They are not significant enough that I would ever discourage a woman from having a baby. There are certain higher risks of certain chromosomal problems, as you know, and a slight increase in certain delivery difficulties. But the overall chances of success are so good that I just wouldn't think about it at all, and just always check with your obstetrician. They'll tell you if there's anything wrong. Good luck. Anybody else have any more questions? One more quick one. Yeah, just stand up.
Yeah, I was wondering if herpes can be spread without a lesion present?
Good question. This is a tough one. We have found in the laboratory that we can measure viruses coming from women who don't seem to have lesions. It's not common. Are these viruses as strong as the regular herpes virus? That's a question, because just the fact that you can measure viruses doesn't mean, that you can't infect it. So I would say we're not sure, but we consider it, most of us, that it is safe in between lesions, and that's the best information. Otherwise, what is your choice? But to be extra safe, you can use barrier methods of birth control. Okay, that's all the time for questions from the audience. We'll be back with more Medical Journal in a second. If you always put baby to bed with a bottle, you might want to think twice. New studies are showing that this common practice often leads to tooth decay in toddlers. Okay, it's time for the answer to the quiz. May I have the object, please, sir? This gentleman thinks this is for doctors to use affixing their corporate seal to papers. We've got cookie cutter, we've got altar boy putting out the candles. It is actually none of those things. The question is, what is this thing? It does come apart. There's some mechanical movements, and you know something? This has probably been used on most men in the audience right now. This is what's used for neonatal circumcision. Okay? Everybody's crossing their legs, looks of discomfort. I will not describe to you the details of this medieval instrument of torture, but I think a lot of you know my feelings about circumcision, and most physicians feel it is medically unnecessary. We're the last country on earth that still does this routinely to little boys. Okay, that's all the time I'm afraid we have for Medical Journal, but until next week, please join us again. Be well. I'm Dr. Dean Edell.